Hello, I'm Dr. Vikas Sharma, MD in Dermatology and a member of International Society of Hair Restoration Surgeons. Today I'm going to talk about male pattern baldness. Male pattern baldness is also known as male pattern hair loss or androgenic alopecia scientifically. What it basically means is thinning or loss of hair on the top of your head. So basically when this area gets affected predominantly, this is the type of baldness that you have seen most commonly. This is what is known as androgenic alopecia or male pattern baldness. In this, you may either have a recession of hairline from the front, or thinning of hair on the back of your head, or thinning of hair on the top, or a complete loss is also seen. According to the degree of loss, the hair loss is divided into 7 categories. Also, the hair on the beard, chest, arms are also resistant to this type of hair loss. Now, the reason for this hair loss are primarily two. Number one is a genetic history. For example, if someone's father or maternal uncles or paternal uncles have a history of hair loss, the offspring or the children are also likely to develop a similar hair loss. Number two reason is a male hormone called dihydrotestosterone or DHT for short. Both these things when combined lead to a progressive thinning and shortening of the hair on the top of the head, and this eventually presents as baldness. Now, in the initial stages of androgenic alopecia, you can reverse the degree of hair thinning that is there on your head. So suppose if someone has thin hair on the top of their head, they can use various treatments to make those hair thicker and stronger. That in turn gives an appearance of a better or a good density. There are basically 3 modalities of treatment for androgenic alopecia. Number one is minoxidil. Now, minoxidil basically works on the blood vessels of your scalp. It makes them a bit dilated so that it improves the blood flow of your scalp. It leads to progressive thickening of the hair and strengthening of the hair. The hair becomes longer and thicker, giving you a better density. It may take 6 to 12 months to give you the desired results, and it has to be continued obviously till the time you want the results to be there. Number 2 method that you have is PRP. In PRP, a small amount of blood is taken from your forearm, like it is done a blood test, and then it is processed to prepare something which is called platelet-rich plasma. Now, platelet-rich plasma is rich in growth factors. This can be injected into the scalp to induce hair growth in the affected area. Number 3 is finasteride, which basically blocks DHT or dihydrotestosterone's production. Now, how it acts is once DHT is not there on your scalp or your body, it basically allows the thin hair to become thicker and stronger. How it can help is it can improve the density on the top of your head by making those same hair stronger and fuller. Now, at the same time with finasteride, there can be a few sexual side effects also in a few patients because it is blocking a male hormone. Now, these 3 methods are useful only when there are thin hair present on the top of the head. As I have explained, these methods can make the thin hair thicker. They cannot regenerate new hair. Now, if you have almost completely lost all the hair on the top of your head, in that situation, hair transplant is required. Or for example, if somebody has a recession of hair till this point, suppose, and he has lost all the hair in front of that line, in that situation, only hair transplant can give him or her hair in front of that existing hairline. So wherever there are bald areas, hair transplant can be done. Now, hair transplant basically involves the transfer of hair from the backside of your head or from the undersurface of your jawbone or from your chest or other body parts to the required area, which is usually the top of the head. In hair transplant, these hair are taken one by one, usually in a FUE method, and then they are implanted on the top of the head where they keep on growing for a long period of time. If there is anything else that you want to know regarding minoxidil, finasteride or PRP, please write it down in the comment section below. I will try to make a video regarding all these things. Also, if you like this video, please subscribe to our channel so that you can get more information about hair loss.